So, there's really this intensifying concern, if you will, that the COVID vaccine distribution is really slower than we expected. We heard that initial goal of vaccinating 20 million Americans by the end of 2020, but we really didn't get close to that number.
Yeah, and in fact, what's happening, the vaccine's getting out to the states. I mean, the FedEx trucks and the UPS trucks are being rolled out, and so the states are receiving vaccine. It's just that we're only now learning that Operation Warp Speed pretty much just considered their remit up to there. There was really no national plan for actually vaccinating the American people. And so what you've got is this kind of fragmented system of the pharmacy chains and some of the hospital systems without any real uh, mechanism to get to the point where we need to be. I mean, if you do some of the back of the envelope calculations, we need to vaccinate about three-quarters of the US population. That's 240 million people by September, let's say. So, and that means when you do that math, that's a million immunizations a day, maybe 1.5, because some of the vaccines have two doses, 1.5 million immunizations a day.
So how
How
do
are
we
we going
do
to do
that?
that? Yeah, I mean, and all we're hearing about is Rite Aid and CVS and some of the grocery stores and Walmart and Sam's Club, and you can't vaccinate 1.5 million Americans a day by calling around the Sam's Club and CVS for your mother or your father to see if there's vaccine out there. And unfortunately, that's happening too often. And it's nothing against the pharmacy chains. I think that they've stepped up as much as they can. It's just there was this lack of situational awareness that we need something beyond that as well. And hopefully, in the new administration, we'll start putting something like that in place, whether it's opening up Yankee Stadium or Giants Stadium and to do something outdoors to get large numbers. We need a mechanism for high throughput vaccination. Number one. Number two, we've got to do things that are less fussy. I mean, if you look at the Advisory Committee on Immunization Practice (ACIP) guidelines coming out of CDC, it's got this laundry list of different essential workers, this and that. Who's going to be the gatekeeper of that? The pharmacist. We can't ask the pharmacist to do it. So we have to streamline the guidelines, put in place a high throughput mechanism, and this is why we pay taxes to the federal government. We need the federal government to intervene here. This cannot just be left to the states. It won't work.